Primary survey. We can use Dr. ABC to assess a casualty. Danger. Before approaching the casualty, always make sure the area is safe. Response. Check if the casualty is responsive or unresponsive. As you approach them, introduce yourself and ask questions to see if you get a response. Kneel next to their chest and gently shake their shoulders, asking, "What has happened?" Open your eyes. If the casualty opens their eyes or gives another gesture, they are responsive. Airway. Check that the airway is open and clear. Open the airway by placing one hand on the forehead to tilt the head back and using 2 fingers of the other hand to lift the chin. If they are unresponsive, you need to move on to breathing as quickly as possible. Breathing. Place your ear above their mouth, looking down at their body. Listen for sounds of breathing and see if you feel their breath on your cheek. Watch to see if their chest moves. If they are unresponsive and not breathing, you need to call 999 or 112 for emergency help and start CPR right away. If they are responsive and breathing, move on to circulation. Once you've established they are breathing, look and check for any signs of severe bleeding. If yes, you will need to control the bleeding. Apply direct pressure to the wound. If they are unresponsive and breathing with no bleeding, put them in the recovery position and call 999 or 112.